Hi, my name's Jonelle Potter, and I'm a nurse practitioner in the Department of OBGYN at the University of Miami Miller School of Medicine.
My name is Lindsay Smith, and I'm also a nurse practitioner in the same department.
Hi, my name is Nelly Diaz, a nurse practitioner in the OBGYN department at the University of Miami.
And we're going to tell you a little bit about our program for pregnant HIV positive women that we've had established since the early 1980s. We see about 150 HIV positive pregnant women a year, and our population has transitioned a little bit. We're based here at the county hospital, and so all of the providers in town, because of our access to clinical trials, refers pregnant HIV positive women to us, where we have Ryan White Part D funding to provide case management, patient navigation, and CNM directed care. Our patients are primarily known HIV positives who are referred in once they have a positive pregnancy test. However, about a third of them are newly diagnosed during prenatal care, and that's a population that has never been diagnosed with HIV before. They find out during pregnancy and they're sent to the medical center, where we have two programs. The first program is for the newly diagnosed women who are comfortable in a group setting. We call this the low acuity group. If they are willing to receive prenatal care in a group setting, they're matched by gestational age. The one requirement is that they are comfortable talking openly about HIV, and it's in this environment where our two nurse midwives implement the centering in pregnancy. The other clinic that we have are for women that are not comfortable disclosing publicly to others in the group, or that have a history of substance abuse where they're not necessarily adherent to prenatal care and need encouragement and opportunities to miss and come back, where it's not really, prenatal care is not designed as a weekly type of intervention. And we see those in a medical model in the hospital clinic with other pregnant women, and it is also a nurse practitioner run model with an OBGYN perinatologist as the attending. Lindsay, will you tell us a little bit about the centering pregnancy model that we've adapted for HIV?
Sure. So centering pregnancy has been around for quite a while, but there really haven't been too many groups for HIV positive women. I think there's one in Texas, and we are the second one. So the idea is that all of the education that you would normally do in your one-on-one prenatal visit happens in a group setting. So the patients will come and they will be involved in getting their own vital signs, taking their own weights, blood pressures, dipping their own urine, so it's very patient-centered, but one of the midwives is always kind of overseeing it. And then there'll be a brief period of time where they have some privacy, although still in the room where the whole thing is taking place, to have the fetal heart check and to speak with the midwife privately for a few minutes about their medication, any problems they're having, any questions they might have. But then the bulk of the group, like 70% of the group, is going to be in the group dynamic, where everybody's sitting in a circle and talking about various topics that are pertinent to that time in their pregnancy. And we meet once a month for the first 2 trimesters, and then every 2 weeks for most of the rest of the pregnancy, and then every week for the last month. And topics will usually be one pregnancy-related topic, such as common complaints of the second trimester, or getting ready for labor, stages of labor, and then one HIV-specific topic, such as things that get in the way of taking your medication. How do you feel about taking your medication? How you feel about not being able to breastfeed, and the topics are where we bring them up, but then it's just a really open discussion where we just kind of let it go where it needs to go, what the patients want to talk about. And so you really have, in addition to some education going on, you have a lot of support. The women can really listen to each other and get ideas from each other and get support from each other. So that's centering.
Wonderful. And what happens after they deliver? Nellie, will you tell us a little bit about the WISH clinic that we have established here, and how we transition women after delivery to ongoing primary care?
Yes. After the woman delivers, we see them postpartum, but we want to make sure that they continue with the HIV care, and we transition them to the WISH clinic, that is a clinic specific for women with HIV. And in that clinic, they see the specialist immunologist doctor, and also they have other services like psychology, nutritionist, case manager, and also the gynecologic part that usually is given for the nurse practitioner that took care of her during pregnancy. So usually the patient has a connection if this part of the team is the same that the patient saw during pregnancy. And the goal is to keep her in very good health and keep her undetectable and in continuity of care for the HIV. And also we do the coordination for other services that the woman needs.
In collaboration with pediatrics. So pediatrics comes to the centering in pregnancy and meets the mom. The mom gets to see where the baby will be screened. 99.9, 100% of the time, the baby will be negative, so the baby has to come for a few tests and then be transitioned into care for themselves. So that's our perinatal model that we have here at the University of Miami.